I'm Dana Ritchie with the American Healthcare Association and National Center for Assisted Living. I'm the Senior Director of Not-for-Profit and Constituent Services. In this role, I work very closely with our not-for-profit members, our veteran service providers, and our intellectual and developmental disability providers. In addition, a big focus for the entire association right now is the workforce crisis that the long-term care sector is facing. Across the teams at the association, everyone is very focused in on this matter. We've heard countless stories from providers about the impact that it's had on the centers and the individuals that they serve. In fact, according to the US Bureau of Labor Statistics data, over 420,000 jobs in long-term care, including in nursing homes and assisted living, were lost since the beginning of the pandemic. This workforce decline must be properly addressed by policymakers and the federal government. The association has been working on several different areas, policies, and programs to help with this crisis and to assist with moving the needle on the matter. The American Healthcare Association and National Center for Assisted Living has been focused on immigration policies and solutions for several years. In particular, right now, as our providers are dealing with the workforce crisis during this pandemic. There's a few different efforts that the association has been doing over the past several months in particular to try to help alleviate some of the pain that this workforce crisis has created. I'll give you a few of those examples now. Last year, the association led a long-term care coalition letter to the State Department focused on the crisis and offered solutions to the department to help address the workforce crisis. We have heard from providers the immigrant visa processing is incredibly backlogged due to COVID and reduced staffing at US embassies and consulates. And many of the healthcare professionals with offers from the US long-term care facilities with approved immigrant petitions have been waiting for months, in some cases more than a year, for a visa interview appointment. We also sent a coalition letter, and this coalition consists of a variety of long-term care providers and others in the healthcare space. We did send another coalition letter to the Department of Homeland Security and the United States Citizenship and Immigration Services on workforce supply related issues. In the letter, the coalition specifically noted that the US currently has a labor shortage in many sectors, not the least of which is the healthcare industry. One issue that we brought up is the significant delay in the citizenship agency processing of employment authorization document renewals. Some employees have had to stop working due to the citizenship agency not timely processing these employment authorization document renewals, while others are simply at risk of losing work authorization due to the delays. Post this coalition letter going in, we did receive a response, or the citizenship agency actually just posted an announcement noting that effective immediately, if you are a healthcare worker who has a pending employment authorization document renewal application, and this documentation expires in 30 days or less, or has already expired, you can request a quickened processing of this documentation application. If this process would have been in place for the story that we had heard from one of our providers that actually lost staff due to this delay in processing, they wouldn't have lost those staff. So this coalition effort, we certainly got some traction with it and had a positive outcome here that helped move the needle. The association was also recently featured in a US News and World Report article on our immigration-related coalition efforts. So those are some of the focuses that we've been doing with federal agencies that have jurisdiction over these matters. But in addition, we've also been working up on Capitol Hill on this, and there's a bipartisan bill that's in both the Senate and the House that the association has endorsed. It's called the Healthcare Workforce Resilience Act. The bill numbers are S 1024 and HR 2255. This bill would recapture unused visas from previous fiscal years for doctors, nurses, and their families. The legislation would allow the entry of nurses with approved immigrant visas and allow physicians with approved immigrant petitions to adjust their status so that they can help our nation fight COVID-19 and have a durable immigration status. In addition to setting aside these previously unused visas for physicians and nurses, the bill would also require the Department of Homeland Security and State Department to quicken the processing of recaptured visas for highly trained nurses. Ensuring an adequate supply of nurses and physicians during this ongoing pandemic is critical, and the association, again, has led a variety of efforts to help process or get these immigrant visas processed quicker and bring these much needed healthcare workers to the United States.